Right, so this is the section on how to record the oral health of residents. And one of the really good videos I found, you can see it on the Teeth for Life website, and I actually put it on the next section anyway. But that's a good place to start where you can see people actually doing the job. And yeah, this is me talking. Oh, and as I said, I made lots of videos. So obviously it was a video short, but yeah, this is trying to, as always, prevention is better than cure. And yeah, so the videos will be a little bit longer. And so this one is one that I made, and I think I've got audio to it. And there'll be a bit of repetition in this, but hopefully it'll just help you understand why it's very important to keep the mouth clean. Right, so I think this is another audio, and as I said, there'd be some repetition, but this is how you can actually record someone's mouth, and that can be very useful if you're trying to get a second opinion remotely, and we'll be more about that later on. So again, I haven't made, fortunately, a video of my mouth, but the Mouth Cancer Foundation have some excellent videos, and obviously we're not looking, well, you should check for cancer, but just checking the mouth is something that we should all do once a month. And so I think this one is about a minute long, and I think it said at the start, it's best if you kind of have a buddy who you can check their mouth, and you check their mouth, they check yours. and it's a great way to learn. And so when you're pulling someone's cheek to have a look at the teeth, then it gives you an idea on how uncomfortable or comfortable you can make it.
Hello, in this video we're going to show you how to do a mouth cancer check. This simple check only takes 45 seconds, however it could save your life. Last year, 8,722 adults in the UK were diagnosed with mouth cancer. That's an average of 1 every hour. The number of new cases has doubled in the last 20 years, and more people are losing their life to the disease than cervical cancer and testicular cancer combined. The key to beating mouth cancer is spotting it quickly, so it's really important that everybody knows what the early warning signs are. Without further ado, let's get into it. Firstly, take a quick look at your face and have a feel for any unusual lumps or bumps around your head and neck. Once that's clear, you can then start checking the inside of your mouth. Check your tongue for any unusual red or white patch, lump, or an ulcer that has lasted for longer than 3 weeks. Make sure to check both sides and underneath. Next, run your finger along the inside of both your cheeks. Are there any lumps or bumps? Again, can you see any red or white patches? All clear? Great. Now you should check the roof of your mouth. It can be tricky to get the right angle, and you will need to tilt your head back slightly. Also run your finger along the roof of your mouth to check for any lumps or swelling. Finally, you should then check your lips. Simply use your thumb and index fingers to pull down your lip and check for any red or white patches or lumps. Do this for both the top and bottom lip. That's our step-by-step guide to performing a simple mouth cancer check at home. Most likely you won't find anything, but if you do spot something while you're doing your check that doesn't seem quite right, make sure to book an appointment with your dentist or doctor. Be mouth aware, and if in doubt, get checked out. For more information about mouth cancer, or to find out more about our Mouth Cancer Action Month campaign, head to www.mouthcancer.org.
So as I said, they're an excellent group, and this is just to reiterate what you need when you're doing a mouth checkup. And so you can buy bulk mirrors if you're in a care home, and they work out about 20p each. You'll need gloves, and in that video you could see that the young lad had very moist lips. As you get older, it gets drier, so you need some, to make it more comfortable, you need to get the resident and mouth moist, and obviously the best thing is just some water. And if you don't have the mouth mirrors to sort of move the cheek out the way, you can use just spoons, as it said there. And there was another thing that I didn't actually include on it, but use your camera if you're going to take a photo. And this will be reiterated throughout. So the next bit was just actually showing that you can record using your phone, and the little pictures on the left are actually off my phone, and it was using the camera, as it said there, was £40, and they're 3 years old at least. And the other ones, you can see where I'm trying to disclose myself, use these cheek retractors that probably be maybe too aggressive for elderly people, but that's the way that you can take pictures of your teeth. And obviously I'm playing around with disclosing tablets there. To be fair, I did clean my teeth for a few days to try and get them pink, but it's surprising where you miss, and that's what will be really interesting. So the other thing is that you just have to, as it always says here in the videos that you'll see of people actually talking to residents, yourself, you have to be gentle, you have to be approached in the right manner, and it's always helpful if you're familiar, and so they know who you are. So you have to do the introduction, you just don't pile in. But what you have to do is ask them if they've noticed any change, and then these are the general things that you look for. Is if the gingiva, the gums, and the lips are all kind of a pale pink, and they're moist and they're smooth, then that's a good sign. And as it says there, if you see the opposite, which is they're inflamed, or people say it looks angry, the gum looks angry, you get a rough feel for it. Sorry, if it's rough. And white patches, they can often be precancerous. Now, you don't want to be running to the dentist every time you see an issue. And often ulcers, everyone gets mouth ulcers, and they normally clear up within a fortnight. If an ulcer lasts more than a fortnight, then there are things that you can do, but take a picture if you can, and then you want to get in touch with a dentist if you can, but certainly work out how you can take a picture, and that's always useful because it will be timed. Again, the other thing that I didn't put on that list was a torch to look into people's mouths, but you can use your phone for that and just have a little fiddle around. I still haven't quite perfected it myself, but if that's me being poor with my iPhone, yeah, if you could put the phone light on and then take the picture at the same time, then that seems to work quite well. So the next one is another video by the Mouth Cancer Foundation, and I think this was showing people, how you, in a residential unit, so to speak.
Oral hygiene is important, whatever your age, but as we know that 78% of mouth cancers are now occurring in the over 55s, it is really important that care home residents are looking after their mouths and care staff are looking out for the signs and symptoms of mouth cancers. Regular assessments of the resident's oral cavity is really important. The ideal time to do this is when you are brushing or caring for your resident's teeth or dentures. If your resident is comfortable with you performing their oral care, this is the time to have a look in the mouth and see if there's been any changes by asking them to stick their tongue out, looking under the tongue if they're able to, into both cheeks. When looking in the mouth, it's a good idea to have a pen torch. You're looking out for an ulcer that maybe hasn't healed over 3 weeks, a tooth that maybe is unexpectedly loose, maybe an odour as well, or the denture isn't fitting correctly. Once you've done that, have a look at the face, have a look at the skin. Are there any bumps, any lumps that have appeared, or any moles that have changed shape or colour? This is the time to make a record of this. Now we know that providing oral hygiene care and performing these oral checks might not be straightforward. Some residents have some complex needs. We do know that nearly 58% of people in residential homes have got dementia. In these cases, we encourage staff, relatives and loved ones to use the look, listen and observe method. You know your resident. Look out for any subtle changes. Is there an odour coming from the mouth? Is the resident drooling all of a sudden? Are they losing weight? Listen to their voice. Is it hoarse all of a sudden? Or are they complaining they've got something stuck in their throat? Always look. Are there any lumps or bumps evident around the jaw or around the mouth? Any moles changing at all? These are all signs of a potential problem inside the mouth. In situations where the resident can be a little bit reluctant to have oral care provided or an oral assessment, we can either try a different time of the day maybe, or look at some of the distraction techniques which are really helpful. Meal times are a great opportunity to look, listen and observe your resident. If they're struggling to eat or drink, this needs documenting and raising with the senior person in charge.
Okay, and I can't remember if I put the video on here, if it's live or not, but it's, as you can see, on Mouth Care Matters, so it's an open resource. So we'll talk about dentures a bit later. Oh, but we're going to talk about how to clean the dentures.
In this video, we'll show you how to clean and care for a denture. There are different types of dentures: metal, plastic, some that replace all teeth, and others that replace one or a few teeth. Dentures should be regularly removed and rinsed to remove food debris and cleaned thoroughly at least once during the day to help prevent fungal infections. The denture should be safely removed either by the wearer of the denture or a carer and placed in a bowl or denture container. For a patient who needs help removing a denture, wash hands and put on gloves. For an upper denture, slip finger by side of denture to break the seal and lift the denture out of the mouth. Do the same for a lower denture. If there are clasps on a denture, push them up for a lower denture and down for an upper denture. Partial dentures can sometimes be tricky to remove. Fill a bowl or sink with water. The denture should be brushed over a bowl to prevent breakage with a denture brush or toothbrush for natural teeth. The denture should be brushed using liquid soap or denture cleaning paste. Toothpaste can cause damage to the surface of a denture over time. All the surfaces need to be brushed. Next, thoroughly rinse with water to remove the debris and soap. If a fixative is required, the denture should be dried using a paper towel and a small amount of fixative applied to the Denture should be stored in a named denture pod. It's important to clean the mouth and tongue when the denture has been removed, even if they have no teeth. Ideally, denture should not be worn overnight to let the lining of the mouth recover from wearing dentures during the day.
Okay, so some excellent advice, and you might be familiar with these. So I was hoping if I could get my, oh yeah, so I've got the cursor so you can see that. So this, you just follow it, as I'm sure you're aware, and the green and the red. I think the red is when you need to, tell your oral health champion and see, take it from there really. And so this is the next part of the plan that you'll also be more familiar with. And then there's this part here. Now, I'm not sure how realistic this is. And this is the problem that you have when I'm not sure everyone can record this frequency. My own view is that one good clean in the day is far better than 2 half cleans. And one has to be realistic in what is achievable. And this one is the one that I think is very good. So again, you can find that this one's obviously from Nice, and it's very straightforward. So hopefully by looking at the videos, it'll just give you a little bit more of an idea, how relevant this is and how to do the scoring reasonably correctly. And so this is talking about dental erosion, decay, and gum disease. And so it's a 4-minute long video, and you'll see that clearly I made it a while back.
So this video is to explain the difference between dental erosion, decay, and gingivitis, and how you can control them or stop them. So the enamel in your mouth is the hardest thing we know. So if you watch any crime movies, you know the teeth hang on. And these little clips explain what it's about. What we didn't have so much in the 60s and 70s was this, which is dental erosion.
So one of the things there is that it showed the disclosing. I think a lot of, just in the care homes, a lot of your residents think they clean their teeth fine. And so we'll make a video showing, how you can use disclosing tablets and explain to them that, the relationship between good mouth hygiene and respiratory disease, which was highlighted during COVID. And so perhaps they need either to try a bit harder, or you need to help them a little bit more. So I'll make some videos in the future on that. This just explains something about that can be a problem for anybody like myself who's retired, and you're able to snack a bit more, and then you get an extra sugar dose. So this might talk about drinks, it might talk about different food snacks that you have, but it's all about the amount of sugar that's actually put in your mouth, because it normally takes about half an hour at least for the saliva to start buffering the acidity. So anyway, I think this is about 2 minutes long as well.
This is a video to explain a bit about sensitivity that you may have to hot and cold. That's transient but extremely frustrating. The main reason is normally due to the gums maturing or receding, as people say, and the dentine being exposed, which is the kind of tissue that responds to these stimuli. Three main ones are erosion with acid, tooth wear from poor cleaning, and also stress. And what we're trying to do is to calm the tooth down. Generally, the dentine acquires a natural protective coating that fills in what we call the tubules. But certain things open them up, and they can be mainly carbonated drinks, your orange juice in the morning, your diet with it's got a lot of acid, fruit, and poor toothbrushing technique. Erosion is where the protective coating over the dentine is dissolved and opens up the tubules, as you can see in the previous slide. So the more acidity you have, like the carbonated drinks or more fruit, the more likely you're going to remain in that zone. Similarly, if you suffer with gastric reflux or are sick occasionally, that can have a similar effect. So the other way is by overzealous toothbrushing, normally manually, and that can do the same thing, opening up the tubules. So the best advice for this is follow the instructions on cleaning your teeth in the app and get an electric brush. Generally, if you push too hard, they stall, and these have got better over the years. You don't have to spend a fortune to get a very good one. If you're stressed, often people grind their teeth overnight, then you can make yourself a temporary night guard. And the other thing is to embrace mindfulness. There are many forms of self-help relaxation, YouTube, thousands of books, and also lots of apps. Clearly, if you're after a quick fix, this isn't going to help, and you shouldn't really be taking analgesics. But there is a mountain of toothpaste, and just get one that may work for you. Personally, I find this has worked better for most of my patients, but it's quite expensive to just apply it exactly where the sensitivity is. And finally, with your diet, lots of people complain their teeth are sensitive when they have chocolate. Well, there's a clear option there. Sadly, it's the same with Prosecco and white wine. So if you do have it, you have to wait half an hour before you clean your teeth. Follow the mantra, clean your teeth twice a day for 2 minutes with an electric toothbrush. Spit out the toothpaste, don't rinse. If your teeth are a bit sensitive, you can clean them before breakfast rather than after. But always clean your teeth immediately before you go to bed. Spit out your desensitizing toothpaste and don't rinse.
Right, so I hope you found that useful. To be fair, some of it's more relevant for you than it is for the residents, because I think generally they have sherry, don't you? But whatever. There's a few more of these, and as you can see, I can keep changing them slightly. So any feedback would be great, and as I say, I can improve them with a little bit of time. Anyway, hope you move on to the next one. I think the next one actually has some longer videos that were produced by some health authorities.